my dear PGs, we are back with another series, nice to know area, and that is litigation in obstetrics. Now, what are the events which trigger litigation in obstetrics? There are maternal incidents which causes litigation, and that is one is maternal death, because we all know maternal death is very unexpected because pregnancy is a physiological state and one does not expect of death during pregnancy or childbirth, but it does happen, and that triggers always a litigation. Undiagnosed breech, yes, because baby suffers, that also causes a litigation problem. Shoulder dystocia, blood loss more than 5 liters, because all of this happens because we think that pregnancy is a normal physiological state and we do not expect anything abnormal to happen. Now, yes, if we take a case back to the theater, it again causes a litigation or it triggers litigation. Then hysterectomy or laparotomy, if we do for obstetrics, then it triggers anesthetic complications, venous or pulmonary embolism, third and fourth degree perineal tear is not expected during childbirth. It again causes litigation problem. And unsuccessful instrumental delivery, because that shows that maybe it was not a correct judgment of the service provider. Rupture uterus, which is still not expected. Readmission of mother to the hospital, which causes a lot of concerns and worries from the patient and patient relatives. Now, fetal incident, of course, stillbirth, it causes, I think, both trauma to the patient relatives, and the doctors too. Service provided are more or less cannot be said they are not affected. They are affected equally when a stillbirth or maternal death does happen. Neonatal death, of course, we worry, why did it happen so? So many reasons are unknown, so many reasons are known. But still, a neonatal death is not acceptable either to the patient relative and to the service provider also. But then if it happens, it causes a lot of risk. Poor Apgar score of the baby cannot be explained. Why does it happen? If it, yes, there are some risk factors, yes, it can be explained. But poor Apgar score as such, why did it happen? Needs a lot of conflict between the service provider and the patient and patient relative. Birth trauma, especially like fractures or palsies or even a scratch during C-section, has a lot of litigation or conflict between the service provider and the patient. Now, organization incidents. Besides the maternal and fetal causes, organization also are a target of litigation, like unavailability of health records. If they want a birth certificate or they want some records that may not be available due to poor record keeping or investigation. Critical services may not be available in all the institution which gives obstetric services. So critical service, if the patient becomes critical and if it is not available and they have to search for these services outside the other hospital, then of course it becomes very difficult for the patient party and it causes a conflict, and a risk management has to be done for these patients. Even for neonatal services, suppose we don't, most of the hospitals may not have a very nice neonatal services, and unavailable of neonatal services require the transfer of the baby to the better center. And this also causes anguish and frustration among the patient and patient relatives, because they do not know till the birth that they may have to seek the services outside. Delay in responding to call for assistance. This is one of the common complaints and conflict and risk management, where patients always say that we had been calling the doctor or the nurses for assistance and it didn't happen. So equipment failure. Sometimes some equipment gets failed out, and that also causes a lot of conflict. Conflict over case management. If it is a multidisciplinary management of a case, critical case, and the teams being differing on the management part, leads to a lot of conflict among the patient and patient, because they do not understand what they are always in a trauma, and one team says we want to do this, another team says no. That is also a case of litigation or conflict management. Medication error, sometimes it does happen. This is a very human error, but for patient and patient relative, it may not be so. Retained swab or instrument, definitely it causes litigation. There is no doubt about this. Hospital acquired infection are also a cause of conflict and litigation, and violation of local protocol. Now, another can be poor attitude of the medical practitioner and supporting staff. Because if they are not empathizing with the patient and patient relatives, medical practitioner and supporting staff may not get the cooperation from the patient and patient relative regarding the poor condition of the patient. Like if the patient is in a poor condition and they want that the doctor and the supporting staff should empathize with them and take better care of them. And it does not happen, so they don't like it, and that also triggers a lot of litigation problem. And not active listening to patient concern by giving adequate time. I think we should always listen to this patient, giving them adequate, let them ventilating out and taking care of them, and that also will definitely minimize the litigation. And not demonstrating compassionate and empathetic care. Now, what are the prescription error which causes litigation? Unclear, illegible writing. So this prescription, sometimes these drugs are brought and that which is written, it is not so because they have not understood the prescription, and that causes it looks like that there's a break of trust and between the two parties. So unclear, illegible writing also causes lot of litigation because in prescription, because if some drug is brought which may not be understood by the pharmacy, and that drug, if it is given unknowingly to the patient and something wrong has happened, the patient is not going to take it nicely. Not checking medication after dispensing from the part. We all should check medication before dispensing from the pharmacist, and counseling regarding the side effects of the drugs are very important. Like you are using, I always say that besides iron and calcium, one should always take consent for each and every drug because they have side effects. And if they consent, then only they should be administered. Otherwise, litigation or conflict or risk may be followed. Now, once complications. Now, complication does happen in obstetrics. It's not a very unknown fact. It is a very known fact. But then early diagnosis and management definitely would reduce the litigation if there is a delayed diagnosis and because if you diagnose delayed, then management also is going to be delayed. And I think one should be able to tell everything in honest manner to the concerned patient party that what has happened to the patient. So one should be very clear what they are going to say to the patient and tell the truth, what wrong has gone with the patient, and the patient relative may comply with you. Hospital staff, hospital support. Now this hospital support, if it is overcrowded, there is unhygienic substandard environment. This also, like if something wrong happens, these all things are triggered. Like this has happened, or this was overcrowded, and we did not get the good response. The hygiene was not maintained during labor or delivery. So, and this all causes increase in litigation. Now, lack of protocols and guidelines in the department of in any, I should say, but in the department of obstetrics, if you are practicing according to the protocols and guidelines given by the societies, different societies, that would help to protect, rather than if we are not sticking to them, they will definitely be causing litigation. Now, documentation is very poor. Almost all of us know. Now, fabricating and altering documents is also a crime. There are many ways that investigation in officer in criminology can identify falsification of documents. So we should not fabricate and alter documents. Rather, we should write what it is, and that also helps to support the practitioners. Now, lack of training and retraining of the medical practitioners is a must. Lack of knowledge of the law of land. We should all be very aware with the land law of the where we practice, what is the law, and whether this things comes under their law or not. So all of us should be very aware of us as what are the laws which will help us and what are the laws which are not going to help us. And we should always practice within the law of the country and always performing without an indication may lead to litigation, because if it fails out, if it doesn't fail out, there will be no litigation. But we perform any procedure without an indication, then definitely, yes, if it fails out or if it misfires or triggers, then of course litigation is going to come in. And of course, if we are not very experienced in performing any procedure and we just opt for it, that also causes a lot of litigation, because definitely you should be certified, experienced in doing certain procedures, or you should be doing under someone's supervision who can help you in conducting the procedure. Now, what we should do to reduce the litigation? Counseling definitely is the one and important part. Counseling and involvement of patients in decision and the planning of health services is very important. So, like if you want to do a C-section, which is very difficult, then like say placenta previa. Now, if you want to go for hysterectomy or interventional radiology, then you should be telling the patient, okay, this is the things if we face. If we do not face, we will be out nicely. If we face it, we are planning to do this, and what are the type of manpower we are going to involve and what are the resources we are going to take in account. So counseling and involvement of patient in decision making and the planning of health services is very, very important. Take them into your consideration, take them into the management, and definitely the things will be very, very easy as far as I think. The rightful attitude of a doctor refrains from blaming other care providers for adverse outcomes. Now, all of us know at some or the other level, we all have complications, and we should not blame other health providers who because of the adverse outcome. Rather, we should find out what was the cause and rectify it, rather than blaming that, okay, this has happened, and because this has happened, because we have done this, that also a blaming culture should be avoided. Gives prompt and clear information of errors, if any, and give honest apology. Something if we have done a wrong, suppose we have done ureteric injury or bladder injury, or we have done hysterectomy, we should always be very clear, and we should be always doing we should always give information to the patient and patient relatives that we are and going into this this complications, and then always be telling the client that, okay, these are the things and we are sorry for it. It has happened so, but it was inevitable or evitable, whatever it was. Now, clinical effectiveness is the use of evidence-based in clinical practice, and this should be practiced. So all of us should practice rather evidence-based medicine, and rather than experience-based medicine. Clinical audit should always take place in each and every faculty, but I should say they should take place in our obstetrics, especially doing maternal death audits, maternal morbidity audits, and perinatal deaths. And we should always practice risk management. Practicing risk management will definitely help to minimize this conflict. Of course, once the conflict has occurred or litigation has come or risk has come, one should always see the staffing and workforce place management, because if you are understaffed, if the doctors are not available, if you don't have experienced doctors or nurses or the even supporting staff, that all should be in place. Training, education, and continuous professional education should be main aim of the department to the to the practitioners, so they are trained, educated, and give always in the evidence-based practice education. Use of information technology to improve patient care. So all of us should use the latest thing what is happening around, and that will definitely help the patient care. And of course, each and every patient should be very nicely documented, and all the incidents should be reported.